about his death and his resurrection to deliver them from eternal hell over the sinners' side. Jesus commands us to go all over the whole world, preaching the gospel to every creature over the sinners' side.
I'm a Bolade animation, a health worker, and I'm a staff of the ministry, staff of Worldhope Ministries. And what we are here for is for free medical care to the people of, this village where we are is Adigun Village, but we have many villages that surrounded this place. So we are covering like 20 villages in this environment. That's what we are doing for now. But so far, the program has been started since Wednesday. Today is second day of the program. The morning is for medical outreach, which we are doing now. And the turnout is encouraging. But we have been seeing people from various villages now. So the major cases that we are seeing, we are referring them. Because what we are doing here is not to attend to the major cases, major medical cases, but there are some cases that we attend to, the minor ones, but the major ones, we are referring them, so that there will be a monitoring and an evaluation for them. So that's what we are doing here.
Orúkọ mi ni Mary Akíngbadé láti ìlú Adigun.
Orúkọ mi Akíngbadé Janet, mo wá láti Adigun.
Onílọ́lá Jímọ̀ láti Gbangba.
Orúkọ mi ni Báyọ̀ Adélékè, mo wá láti Ìbálẹ̀.
Àwa gba ìwòsàn ọ̀fẹ́.
Àǹfààní tí wọ́n gbé wá àǹfààní tó wà pa ni. Kọ́lọ́ba kí ó jẹ́ kí ìrànlọ́wọ́ kó tó máa dìde fún àwọn tó ń ṣe iṣẹ́ yìí pẹ̀lú àyẹ̀wò ara, tó àǹfààní ni.
Wọ́n fọ́npá fún mi. Wọ́n sì bẹ́ẹ̀ wọ́n tó yẹ ara mi wò. Wọ́n ní pọ̀pọ̀ mi ga. Wọ́n sì fún mi lóògùn kí n máa lọ lò. Àsanwó ọ̀fẹ́ ni wọ́n fún wa o. Wọn ò béèrè owó lọ́wọ́ wa. Wọ́n mú wá fáǹfààní ara wa.
Wọ́n fún mi ní oògùn oríṣiríṣi, wọ́n fún mi lóògùn.
Nígbà tí mo dé bí ní ìsìn wọ́n ṣe ìfúnpá fún wa. A tún wọ̀n. Lẹ́yìn ìgbà náà wọ́n béèrè nǹkan tó ń ṣe wá nínú ara. A sì complain fún wọn. Wọ́n sì kọ oògùn fún wa. Wọ́n kó oògùn fún wa. Wọ́n sì kó oògùn tá a máa lò, wọ́n kó fún wa.
Oògùn tí wọ́n fún mi ni, ìyẹn pé bóyá nǹkan dúdú ni wọ́n lò pẹ̀lú mi. So tablet náà ni wọ́n lò. Àlàáfíà wa kò ní di fíafíà o.
See, people are in need of medical, and I have some examples that I can just cite. Say, when people in rural areas like this, I will say that they are suffering, honestly speaking. See, they have no access to basic free medical care, no access. Many of them may have to trek 5 miles, 10 miles before they can see any primary health center.
Àǹfààní tó dáa ni mo rí sí, àǹfààní gidi ni wọ́n ṣe fún wa. Torí pé tá bá fẹ́ lọ sí ilé ìwòsàn, a gba káàdì, wọ́n ní a sanwó. Lẹ́yìn ìgbà tá bá gba káàdì tá sanwó tán, wọ́n tún ní àtò. Lẹ́lòmíì lọ sí yẹ̀jẹ̀wò, owó náà ni. Oògùn tí wọ́n bá tún fẹ́ fún wa, wọ́n lè kọ fún wa ni wọ́n lè fún wa lọ́fẹ̀ẹ́.
Àǹfààní tí mo jẹ́ bẹ́ẹ̀ ó pọ̀, kò lákàwé.
Wow, you see, what we are doing is part of mission. Because when we look back, the early missionaries that came to Africa from Europe, from Asia, from everywhere, see, when they came with the gospel. But the gospel that they came with, they established schools, hospitals, right? Because the gospel or the mission is holistic gospel. So without the schools, the hospitals combined with the gospel, see, there will be a limitation as in reaching people. You cannot reach people very well.
Ọ̀fẹ́ tí Jésù Kristi fún wa ó pọ̀, kò ní àkàwé, ó pọ̀ lóríṣiríṣi.
Ìrere Jésù tí wọ́n mú wá bá wa, ó sọ ohun tuntun nínú ayé wa, ó sọ ohun rere nínú ayé wa. A rí pé Jésù ó dára, ká gbà lótìtọ́ àti òdodo, ká sì máa sìn.
Ó fún wa ní ìwòsàn ọ̀fẹ́, ó fún wa ká gba Jésù Kristi gbọ́. Jésù nìkan ló lè gbà wá là nínú ewu gbogbo.
Ẹni tí kò bá ti ní Jésù nínú ayé rẹ̀ kó gbà lótìtọ́ àti òdodo, torí pé ó ní ìyè àìnípẹ̀kun, ó ní agbẹ́kẹ̀lé, kò sí ẹlòmíràn. Bẹ́yàn lọ lé babaláwo wọ́n já yàn kulẹ̀ ni, ṣùgbọ́n Jésù òun ni akiri sóre.
Well, it has been a good experience working in this mission, because as you know, this is mission work, and as a missionary, as a medical missionary, when we go to fields like this, because we just finished one in September, but coming to this place, Oniyanmo village in Ogun State, it's another experience. But people, sometimes I met with people that I will call patients. You see, their problems or their health needs, you will be able to meet them with the drugs that we have on ground. But some with their complaint due to the drugs we have on ground, you won't be able to meet them, yes, to attend to them. But I will definitely write some prescriptions for them. Go get these drugs, buy them. If I'm still going to stay like 2-3 days in that place before leaving, I will tell them that I prefer that they will get those drugs and come and show me before they will start to use it. Because when they go to some chemist, they will take the advantage that because they know nothing. What they ask for, they don't know it. But the chemist will just give them what is available. And it's not what I wrote. Substitute. And they, ignorantly, they will take it and start to use it. Maybe for themselves or for their children, whatsoever. So I do tell them that, please, just make sure that you show me before you start using the drugs. The common complaint, the common one is body pain. That is the common one. Arthritis. That is
for younger people?
For younger people, like today now. I have some cases that their complaint, I just say, okay, this one is having a queried appendicitis. Someone here too, just yesterday, because this medical outreach, we have been on it since yesterday. Today is day 2 for the medical. So I met a boy. The boy should be around 15, 17 years. He complains to me, and I have to book him on appointment that, okay, in the evening, come later, because I need to examine the boy. And I discovered that the boy is having undescended testes. The 2 testes are undescended. It's up. Even before I was able to even feel it or to touch it, I have to go inside before, but the testes are there. The 2 are there, but they are not descended. The 2 testes. So cases like that, though I have to see the parents of that boy, which I will do today. I have to see them and advise them. This thing need a medical attention. And it is surgery. Yes, it's surgery. It's surgery. They will just pull down the 2 testes and the boy will be okay. Here, actually, I would say they have one government health center. But yes, because I came here and I saw one close to Oniyanmo, but the functioning.
It's like not existing.
I'm telling you. I saw it, but I didn't see anything there. I just passed through the place, but I didn't see anything there.
Nobody?
I didn't see anybody. So far, I have attended to 116.
116.
And I still have some names that I will add. I think up to like 20 something. But let me say the average together is around 140. 140, 160, yeah. Yes, since we are from Oyo State and this is Ogun State. So like today now, a guy complained to me and I said, okay, this thing should be appendicitis. So I said, okay, you have to go to a hospital, let them re-examine, and you have to go for scan. So it is the result of that scan that will now, okay, show. But what I'm saying now is still queried because the scan have to confirm it. So when the scan confirms it, then you're having appendicitis. But with the complaint that the boy gave, I told him that it may be until when it's confirmed by the scan. So something like that, I just okay go and see a doctor and let him give you form to go for scan before it can be established that you are having appendicitis. The cost. Wow. It's not easy anyway. And the cost of the drugs, say the actual price may not be, but it's going to around 120. The previous ones, no, but for this one, we have a donor. But for the previous ones, it is helping the church and helping the community. You have people around that maybe this CBS, yes, they are doing it, but they cannot do it alone. They can't do it alone. And the impact of this thing is, all these drugs, many people cannot afford to buy them, and they are sick. It has happened before and it's still happening now. Many people died because of, based on avoidable sicknesses. That is avoidable. But some are ignorant. Some are poor to that level that they cannot afford it. And some have the money but they are ignorant. So they need people to sensitize them. They need some orientation. But doing this thing, we open the eyes of many people. Some are even taking drugs that they don't even know the names. And at the same time, the government alone cannot do this work. Government cannot do it alone. So it's like even helping or assisting the government to meet the needs of the people. And I thank God that what we are doing, God is happy about it. Because we are saving lives. On Oniyanmo medical outreach that I've started since yesterday. We started 9 a.m. yesterday. And when we go and when we have gotten to something around 3:30, we have to stop to go and prepare for the crusade in the evening that will start by 5 o'clock. So we have to stop, have a short rest to refresh for the crusade. But people are still trooping in that yesterday. So we have to say, okay, let us extend this day today. That was yesterday. Because some places we have it just for one day. And we will cover everybody. But we are serving people since yesterday. But thank God that we covered everybody today. Based on that, many surrounding villages also benefited from it. Not only people from Oniyanmo. I think I will remember some names that I got. Some names of some villages. Alaga, Reserve, Oniyanmo. I think those are the names that I can remember now.
Even if you want to evangelize people, you need to keep them alive. You cannot evangelize the dead. So we need to keep these people alive and also healthy. Yes, we're evangelizing, but we can only evangelize the living. Once they are dead, you cannot witness to the dead. And that's why I'm saying I'm saying that keeping them alive is very, very crucial to evangelizing them and save them for the Lord Jesus Christ. We're already ministering to them. It's very important. If the work of evangelism should be effective. Now we cannot do it alone. So I'm inviting you to join us. You can contact us on the phone numbers that are on the screen there. And you can reach us by WhatsApp or whatever. God bless you.
Jesus, carry Jesus.